Welcome to Community Health Matters. I'm your host, Kristin Priesol. On our show today, Dr. Michelle Fiscus, president of the Tennessee chapter of the American Academy of Pediatrics, joins us to talk about addressing the issue of overweight and obese children. And we'll learn about an innovative program called Tied Together, a dynamic parent education program designed to build on the strengths of young families. Substance abuse during pregnancy can result in agonizing drug withdrawal for the newborn. Today, Dr. Karen Dapolito, director of the neonatal nurse practitioner program at Vanderbilt University School of Nursing and March of Dimes volunteer, joins us to talk about this growing concern and the steps being taken in Tennessee to help prevent it. All of that coming up next on Community Health Matters. Did you know children who are overweight or obese as preschoolers are 5 times as likely as normal weight children to be overweight or obese as adults? Obese children are more likely to become obese adults and suffer lifelong physical and mental health problems as a result. Ask your pediatrician about community resources that promote healthy eating and active living, and set a good example by modeling healthy behaviors for your kids. We would like to welcome to the program Dr. Michelle Fiscus, who is a pediatrician in the Cool Springs area. Thank you so much for being here.
Thank you for the opportunity.
Yes, and so nice to talk with you. We're going to be talking, by the way, about obesity and overweight children. If this is something that pertains to you or you'd like more information about it, this is a segment you definitely want to watch. If you wouldn't mind, Dr. Fiscus, just explain, I guess, the difference, first of all, because there is a difference between obesity and overweight children.
That's right. There is a difference between obesity and overweight. And I think it's very important for parents to understand that it's really a clinical determination and not a judgment call on the part of their child's physician. So there's something called a body mass index, which is or the BMI that people might hear about. And that takes into account a child's sex and how old they are and their height and their weight. And then there's a calculation that's done to determine the body mass index based on that data. And then that body mass index is plotted on a chart that shows us what normals look like for those different ages. So an 8-year-old girl is going to be plotted against another 8-year-old girl. If that child's body mass index is greater than the 85th percentile, then that's considered overweight. And if it's over the 95th percentile, then that's considered obese. So it's a measure that we use, much like people use a blood pressure measurement. If your blood pressure is over a certain number, that's considered high blood pressure. If your BMI is over a certain number, that's considered either overweight or obese, depending.
There's been so much talk in the last several years about children, you know, you don't want them to become obese, you don't want them to become overweight. There's things that you can do to prevent that from happening, regardless of a family history or that kind of thing. So as you said, it's a clinical diagnosis, but it's also become a serious situation. You, we should also mention, are the president for the Tennessee chapter of the American Academy of Pediatrics. So you see things from a statewide perspective as well. Can you give us an idea of where Tennessee ranks when we're talking about obese children?
Well, the South in general ranks very high on the obesity prevalence scale. So when you look at the country altogether, southeastern states tend to be more obese than the rest of the country. Tennessee is currently 4th as the most obese state. So we rank under West Virginia, Mississippi, and Alabama, but we're number 4. That's really looking at adult numbers more than children. About 1 in 3 Tennessee adults is considered, it plots out as being obese on the BMI charts. For children, it's less than that. And that number's actually improved for young children, which means that we're starting to move that needle in the right direction for this next generation, which is very important.
Absolutely.
We spend an awful lot of our time trying to prevent adult disease by raising children in the healthiest way that we can and helping their parents do that. And so, so some of the efforts that we've made across the country through American Academy of Pediatrics and other places has helped to kind of move that the right way.
You know, when we talk about children, just in generalities, I think people probably tend to think of that 8-year-old girl that you had mentioned. But when we're talking about obesity or just even overweight issues, it can happen in children as young as 3 or 4. I mean, toddlers.
Right, and even younger than that in some cases. I've had personally some extremely obese 9-month-olds in my office. And a lot of that comes down to dietary choices that are being made. We know that there's some data to suggest that early breastfeeding might help for an older child to make better choices in the foods that they choose. More water, less sugar-sweetened beverages, more fruits and vegetables in their diet if they have a history of breastfeeding. So breastfeeding can have a positive impact. But there's so many different issues. Your zip code, do you have access to fresh fruits and vegetables on a regular basis? If the fastest place for you to get a meal is a fast food restaurant with a $99 or 99-cent hamburger, then you're much more likely to eat there. So socioeconomic situation, zip code, whether or not your parents are obese, whether or not you're home with your parents versus maybe in a daycare center. There's so many factors that lead into adult obesity that we're trying to regulate the best we can.
Sure. And as you said, it starts off when they're very young. Something that I know some parents as of late have tried to do is, grow the vegetables in your backyard or do something that the child can actually see and be a part of, take them grocery shopping, just expose them as much as you can to the fruits and vegetables and whole grains and things that are good. Would you recommend that, as being a pediatrician, is that something that you would suggest to, the parents of a patient who might be struggling with something
absolutely.
like this?
If you can grow it at home, that's fantastic. When you take your children to the grocery store, you want to try to stay around the outside of the grocery store and not on the inner aisles where the more processed foods are. And then, fruits and vegetables don't get targeted during television programs. Sugar-sweetened beverages do. Sugar cereals do. So watching, even screen time for children can impact how they eat and the choices that they make as they get older.
Yes, and being outside is very important too, being active. Can you talk a little bit about even implementing exercise at a very young age and the importance of that?
Absolutely. At least an hour a day. That would be the best thing for us to see, is an hour a day of physical activity. It's difficult to do. Parents work, kids are in school. There's always threats to physical education in the school systems, and so keeping that in is extremely important. But trying to get kids outside as much as we can and finding ways to disconnect them from internet and video games and screen time and get them out and moving is always going to be a beneficial thing.
We have to keep in mind there are long-term possible complications, health complications, if you don't curb this issue early on.
Right. Yeah, so a lot of the things that we see are early type 2 diabetes, which when I was in training a long time ago, we never saw type 2 diabetes in young children, and now unfortunately we do, and that's all weight related. We see early high blood pressure in children because of their weight. We'll see joint problems, and not to mention also the social and psychological impact that being an obese child can have on your relationships in school, your ability to participate in sports and the like.
Also, there's some other things that parents probably should consider, this time of year when the kids are more indoors, and we're talking winter, even early spring. What are some things that parents should keep in mind?
Right, so hand washing is critically important. If your child has a fever over 101, they really shouldn't be attending school. Most of these early colds and flus that we see are transmitted through respiratory secretions. That's basically sneezing and coughs and snot. So encouraging your children to wash their hands after they blow their nose or wipe their nose, making sure they're covering their coughs. Soap and water is always better than hand sanitizers. If you can get that in too, that would be great. But definitely if they have a fever, they need to be home.
Yes, and a lot of doctors' offices nowadays have the triage nurse, somebody available who can kind of consult, somebody who might be having some issues at home.
That's right. Any office will have a nurse that will speak to the patients about whether or not they need to come in. Most pediatric offices will have the ability to see a child the day that they're sick, or at least, within a day or two, depending on what's going on with that particular child. So they should always call their own doctor first.
All right, if somebody is looking for a new pediatrician, what is one of the main things they should think about? If you can offer up some advice with that.
Ask your neighbors.
Okay.
Ask your preschool or your school nurse and see who they've worked with and who they've liked. And then call that office and set up a time to go in and talk to that pediatrician. Most pediatricians will sit down with someone free of charge and get to know them so that they can help them make that best choice.
All right, pediatrician Dr. Michelle Fiscus, thank you for your time today. You gave us excellent information, a lot of great recommendations. Thank you.
Thank you.
Did you know you and your child can learn how to make healthy food choices together with the help of the Sesame Workshop, the nonprofit organization behind Sesame Street? Learn how to eat well on a budget and get tips for teaching your child healthy eating habits. Educational materials are available in both English and Spanish at sesamestreet.org/food. How do you encourage parents and kids alike? Well, the Martha O'Brien Center knows how. They do both of those things and so much more. And we are so delighted to have on the program today President and CEO Marsha Edwards. Thank you so much for being here.
Thank you.
And also the director of Tied Together, which is a program over there at Martha O'Brien Center, Miss Cheryl Horton. Thanks for taking the time, ladies, to be with us today.
Thank you very much.
Thank you.
For those folks who might not be as familiar, everyone probably has heard Martha O'Brien Center because you all do such tremendous work here in the city. But for those who don't know much about your past, can you kind of give us an idea about your involvement in the community?
Well, Martha O'Brien Center we're sort of an old lady in this town. We're 120 years this year. We have been in East Nashville for the last 60 years. We are a cradle to career organization, so we have programs for young children, young families, as well as older adults and people who are moving on to college and greater careers. We're located in public housing in the James Casey homes.
As I mentioned, we're talking about encouraging parents and kids. You all have a lot of great programs over there, just as you were mentioning, Ms. Edwards, and one of them called Tied Together. If you don't mind, Cheryl, tell us what that is.
So Tied Together is a 10-week parent education program where we really focusing on encouraging, educating, and empowering our families just to just strengthen the family units.
What types of families are attending or taking advantage of a program like this?
Well, I think our families vary in age. Some of them are very new parents, and some of them are parents are of older children, as well as we have aunts, uncles, grandparents, just anyone who's helped in the system raising the family.
So it's open to the community. Anyone can come.
Yes, ma'am. Absolutely, yes.
All right. Tell us the importance, if you don't mind, Cheryl, and please, you as well, Marsha, join in on this answer as well. Why family education is so important, especially in this day and age.
Yes. Well, family education is the first education that children receive. So I think that sets the precedence of their future success.
And what we think is really important is that families, families live in communities, and so we really think it's very important that families learn together, and so we really emphasize a lot of times people that live in public housing or in low-income communities, they don't have a lot of family to rely on, and so the class becomes a very close-knit family, and because they're all kind of dealing with the same things. They're trying to be great parents to very young children under the age of 5. Sure. And we really believe that it's very, very important that families are thinking about all the developmental issues well before school time.
You know, a lot of families, well, whether or not they know this exists or not, might have a little, they might be nervous about trying to put themselves out there and be vulnerable and say, listen, I would like some support, I would like this education, I would like this help. Do you find yourselves, extending that word in a certain way and getting out the message a certain way? Or do you find the families that have already taken advantage of programs like this kind of, bringing other families in as well?
I think we experience both. I think, coming to a new environment, maybe they're not familiar with the Martha O'Brien Center. Perhaps that Tied Together is their first stop on the highway of services that Martha O'Brien provides. And I think it's just how you even come at them. They are the expert on their children. They know their children best. We have a certain expertise, but they are the experts on their children, and just even speaking with them from that paradigm is something that's very relaxing to them.
One thing I will say about Cheryl and her team is that it's a very joyful experience. People don't come there because, they're not good parents. They come because they want to be better parents, like all of us do.
Exactly.
Yes, absolutely. And that's what you're offering.
Oh, absolutely.
Is that encouragement, like we've been talking about.
Absolutely.
Let's talk also about specific parenting tips that you all discuss and how you go about doing that.
So one thing that we do, we always want to focus on reading. Reading is so important. Books tell stories that sometimes parents can be afraid to talk about, right? And so what a wonderful way to really bring your topics to life, if you will. We speak about brain development because it's so important for parents to be to understand that brain development begins in the womb.
Yes.
And we also speak about healthy eating habits. We talk about some appropriate ways to discipline our children because we understand they have behaviors that they need some modification, right? So, and then we do it in a fun and loving way. We invite experts to speak about specific topics, and we really help families to understand that it's so important to nurture your family, but it's important to nurture yourself first, because you can't give a child what you don't have to give them.
So well said. You know, obviously you all are seeing parents who have children, you know, a family already in place. But then you also, you know, have lots of conversations and share your wisdom with families who are just starting and moms who are pregnant. I find it's terrific that the Tied Together program also talks about and addresses infant mortality.
Absolutely. We always want to have families understand the safe sleep, which is the ABCs of sleep, alone, on their back, in a crib. And that might be a message that might be their first time hearing. And we really want them to understand the importance of that, because these are deaths that don't need to happen. If we have one too many.
Sure. Obviously, programs like this set certain goals.
Yes.
If you can kind of tell us what some of those goals are, and if you've been able to reach them as well.
I think one of our biggest goals is school readiness. You know, education starts in the home, and the more prepared children are, the earlier they are prepared, the better they will be for school. And so I think that's one of our primary goals.
I think, you know, we don't want to see families be disrupted because families aren't equipped to be the best parents they can be. And so a lot of the conversation around discipline and other things like that are really about just educating people about what is appropriate and strategies to deal with children when you are tried, shall we say. So I think we do not want to see disruption in the family. I think one of the things I think that is so powerful is that they have this opportunity to sit for an hour with a pediatrician. Now, I don't know, when my babies were small, sometimes I left the doctor's office and I didn't have the answer I needed. And so one of the things that's really valuable about this is the way that Tied Together brings experts, nutritionists, librarians, physicians, Department of Children's Services.
That's right,
into that conversation in a very non-threatening way, and people can just ask what they really need to know.
Yes, and that's so important. Like you said, you don't really get that anywhere else. Even when you make that appointment or whatever, they just don't have that time.
Right, and I think it's also so important when you're asking to go to a different, you know, the Department of Human Services, for instance, it's good to see a representative there in your community instead of you having to go out, so you can get all the questions and get a good understanding of what the services are.
If you all could offer up some advice to all of our parents who are watching today, this program, what would that be in terms of what you believe to be most important from your perspective?
I think reading to your child at the earliest age is so very valuable. And children learn best through play. Get on the floor with them and play. That's how they're learning, and that bonding and that nurturing is so very important.
And I would just say, and we say this all the time, but parents truly are the first teachers. So as the teacher, just try to gather as much information as you can and surround yourself with other people who are really engaged in that conversation. You will find them in every neighborhood, people who are really engaged in trying to do the very, very best for their children, no matter what their resources.
Oh, excuse me. The Martha O'Brien Center obviously is doing some amazing work. What would you like to see, if any other additional program come aboard or what you're working on? And I just ask you to point out something quickly if you don't mind.
Well, there's been a request in the community. We have over 350 graduate families. There's been a request that we do a kind of still tied together, which is an adolescent parenting, because that becomes the other kind of tight space for parents is adolescence and what to do with it.
Exactly.
Excellent. Well, continued success, ladies. Thank you so much for your time today.
Thank you.
Appreciate it.
Thank you.
Did you know if you take drugs during pregnancy, they can pass through the placenta to your baby in the womb? Then, because they are no longer receiving the drug after birth, the newborn infant may suffer painful symptoms of withdrawal. This is called neonatal abstinence syndrome, and it's a growing problem here in Tennessee and across the country. If you are expecting a baby and you're using drugs, including alcohol and tobacco, ask your health care provider for help with stopping as soon as possible to keep you and your baby safe. Substance abuse is a very serious issue, but when we're talking about pregnant women who have this issue, how does that affect and impact the newborn? That's where we're going to be focusing our attention right now. We welcome to the program Dr. Karen Dapolito, who is the Director of Neonatal Nurses Practitioner Program over at Vanderbilt, also a volunteer over at March of Dimes. Thank you so much for being with us.
Thank you for having me.
We really appreciate it. I just want to first point out that there was a tenfold increase in babies born with neonatal abstinence syndrome, and that came in Tennessee from the years 2000 to 2010. If you can tell viewers what neonatal abstinence syndrome is.
Surely, I'd be happy to. Neonatal abstinence syndrome, or NAS as we call it, it's really a condition in which infants exhibit clinical signs of withdrawal to drugs that they were exposed to in utero. And as a result of this, many of them require treatment and prolonged hospital stays.
Yeah, and obviously it can be serious depending on what drug was used and for how long.
Absolutely.
Correct.
Absolutely.
All right. What are some of the symptoms, I suppose, a baby would have as soon as they're born? What can you tell us as far as NAS
Well,
is concerned?
babies can have physiologic as well as neurobehavioral signs of withdrawal. Some of the physical signs include things like sweating, nasal stuffiness, sneezing, poor feeding, increased respiratory rate, loose stools. So those are some of the physical signs, modeling as well, that you might see in a baby with NAS. Some of the neurobehavioral signs include tremors, irritability, crying, increased muscle tone, problems with sleep.
All right, and these are symptoms that you will notice right away?
If you're knowledgeable about the syndrome and you know what to look for, you can pretty much identify babies that possibly have been exposed to drugs in utero.
How long will a baby have these symptoms before they're starting to get on track for good health?
Surely. I think a lot of it depends on the drug that the baby was exposed to. It also depends on when the mother took that drug prior to delivery. It also depends on how much of that drug has been transferred from the mother to the baby, and also how well the baby has metabolized the drug themselves. So all those factors will play a part in terms of the severity of signs of withdrawal that you may see. Typically a baby may be in the hospital anywhere from 2 weeks to a month or a little more, depending again on the severity of the withdrawal and whether or not we can adequately capture them with our management.
Are there common drugs that are used that are linked to NAS?
Yes, a lot of the narcotics, a lot of the opioids, whether they be prescription opioids or opioids that individuals can purchase on the street, such as heroin. Another one is methadone. And we have seen an increase in the number of pain clinics within our state. And it could very well be that because of more women being prescribed pain medication for chronic pain, that has contributed to the increase in NAS that we've seen.
And what's the treatment for these babies as soon as they're born? What happens?
Well, we do two things. One is we control their environment. We like to provide a quiet environment, a very dim environment for them. We encourage the mothers to participate in the baby's care and to hold the babies as much as possible. We swaddle the babies. We allow them to suck on a pacifier. We provide boundaries if need be so that the babies feel secure. So those are some of the environmental things that we do. But pharmacologically, we can always manage them as well with opioids such as oral morphine or methadone. If we get to a point where we can't control signs of withdrawal with those opioids, then we would add additional drugs to that.
There are so many terrific hospitals, obviously in the state of Tennessee, but are they equipped to be able to handle a baby who's born with NAS?
Well, probably the hospitals that just have a regular newborn nursery may have some difficulty because they may not have the monitoring equipment that might be necessary. Well, that is necessary because if we're treating babies with an opioid, they do need to be monitored, cardiopulmonary monitoring. They may not have the staffing for it. They may not have individual rooms that would facilitate the management and the environmental control of these babies. So I would encourage institutions that have a baby who requires NAS care to transfer them to an institution where they can get the care that they need.
And this is different, obviously, with every newborn, and again, the type of drug and how long it was used for by the mother. But these babies can have a good outcome. They can live a good, healthy life.
Absolutely. Absolutely. Usually, once they get through the period of withdrawal, especially from opioids, they don't have any additional problems. Many times you'll hear that possibly babies may have some subacute symptoms a little bit later, several months down the road. If that does happen, it's usually mild and usually self-limiting.
The state of Tennessee has seen an increase in NAS. I imagine that the State Department of Health, as well as the March of Dimes, are doing plenty of things to address it. But if you can kind of enlighten us all and let us know exactly what they are doing.
Okay. Yes, the health department here in Tennessee has been very active and very interested and very forthcoming with looking at this problem and trying to identify why indeed we are having such an increase in babies with NAS. Now it is a reportable condition for the state, so that many of the hospitals are now reporting infants that have a diagnosis of NAS, so we can have a better idea of the magnitude of the problem here in our state. The health department also has developed several grants that have been available to healthcare providers to look at this problem and try to come up with some solutions to the problems. And the March of Dimes has also always been very forthcoming with educational activities for the consumer as well as for healthcare professionals related to substance use during pregnancy and the care of the neonate.
For folks watching today, can you share with them any information or tips that would prevent NAS?
Well, certainly the most important thing is to abstain from using drugs, alcohol, even cigarettes, tobacco use during pregnancy. I think the one thing that's very important to mention is that if a woman is in a situation where she has an addiction or she has a substance dependence while she's pregnant, to get into a treatment program, because the outcomes are very good for women who are in treatment, not only for the mother but for the babies. And understand that neonatal abstinence syndrome is a syndrome that we can treat and that the babies usually do very well. So those are probably some of the main things that I think are important.
All right, the outcome can be good.
Yes.
Is there anything else you would like to highlight regarding NAS that we haven't touched on that you feel is important for viewers
Well,
to
you know, the only thing that I would like to mention is many times you hear people talk about addicted babies. Okay, these babies are really not addicted. They're really exposed. They're substance exposed. So I think we need to get away from saying drug-addicted baby. It has a very negative connotation to it.
Absolutely.
And I think if you look at the definition of addiction, these babies definitely are not addicted to drugs.
So important to point out. Dr. Karen D'Appolito, thank you so much for your time
Thank
today.
you so much.
We appreciate it.
Thank you.
And thank you all for watching Community Health Matters.